This presentation was made for the Environmental and Occupational Health course held at UAMS. Any scenario utilized is hypothetical and for educational purposes only. It does not necessarily reflect the views of UAMS or any other agent. Hi, my name is Pratheepa Ravikumar, and I'm an environmental health specialist working for the Arkansas Department of Health. Today, I'm going to be discussing a little bit about children as a special health population and some of the typical environmental exposures they may face. Since you all are high school students looking to become future pediatricians, this topic should be of very high importance to you and hopefully benefit you in the future. So, a little overview of our presentation today. We're first going to talk about how children are a special health population, so what really makes them vulnerable, what are some of their increased risk factors, and then we're going to look at specific environmental exposures that are common to children, such as things like lead, pesticides, inhalants, and even physical injuries. Then for each of these exposures, we'll look at the method of exposure to these environmental chemicals or toxins or injuries. So for example, how lead could be eaten from paint off the walls. We're then going to look at presenting symptoms for these exposures. As future pediatricians, this is going to be super important for you all to focus on and to pay attention to the signs and symptoms of exposure. We will then take a look at any treatment or prevention plans that we can have for these environmental exposures. And last but not least, we'll look at the environmental regulations or any monitoring surrounding some of these exposures. So children as a special population. It's really important to consider children separate population from adults. There are a lot of environmental exposures and related injuries and risks that are really manifested differently in children in comparison to adults. And most of the things that really make children a special population is actually influenced by their age. A child's age can impact different parameters for exposure, their absorption, metabolism, and even distribution of a certain toxin or drug within their body. So when looking at exposure risks and methods and how children differ in this category, at each age, their environment and even behaviors can change. This can really influence what they're exposed to and how they're exposed to a certain exposure. For example, a baby that has just begun to crawl is more likely to come into contact with hazards on the floor. And at this age, they put everything in their mouths, so they're more likely to get this exposure through ingestion. When looking at absorption, an article from 1995 states that neonates and infants can really differ greatly in terms of how a chemical or toxic compound is absorbed. They initially have skin that's not keratinized or thickened, and this can lead to a greater absorption of the toxin in kids. The article also states that they have different physiological aspects. So for instance, their gastric acid level is not as acidic as it is in adults. This can allow for more bacteria and toxins to evade more into their system and to their body, causing a more negative response than what we see in adults. When looking at metabolism and excretion in children, their immune systems are really still developing, and exposures to certain things can cause a more negative impact on their health in comparison to adults. And also, at different stages of a child's life, there are different enzymes, and the way things are broken down is much more dormant than in adults, which can lead to toxins and other hazards lingering in their blood or system longer than in a human adult. One thing to keep in the back of the mind is that not all children are the same. Every single one of these different characteristics must be really taken into consideration when you have a patient in your pediatric clinic. You're going to have to really consider what age group they fall in, what are some of their behaviors, and really what is their environment like and what things are they going to be more exposed to. So let's first look at lead exposure. Rao and Margold's an article from 2016 state that lead exposure is now thought to really be unsafe at any sort of detectable level. In the United States, however, we don't really think about lead exposure as much anymore. However, we do need to consider some things like toys that are manufactured in outside countries that still contain lead. We have to consider lead pipes that are still in some rural areas or urban areas that have not been changed over the years. We even have to think about older homes that still have paint on the walls that contain lead. This is a common exposure for children under the age of 1 and 2 because they put a lot of things in their mouth. So at this age, lead screenings are actually first done at 1 year of age and then again at 2 years. It's really important for you as pediatricians to screen and look for lead toxicity because it can cause a lot of acute and chronic health issues. Some of the acute symptoms include headaches, appetite loss, constipation, nausea, vomiting, and a lot of other abdominal and stomach issues. And even more importantly, some chronic symptoms include delayed memory, a lot of developmental delay, reaction time, and other neurological deficits. And the article shows that any cognitive effects are usually considered to be irreversible, so it's super important to catch lead toxicity early on. So how can we treat lead toxicity? Rao et al. States that many of the cognitive changes, as we mentioned before, are irreversible. However, some of the acute amounts of lead in the body can be eliminated with things called chelating agents, where it binds to the lead in the body and then it can be excreted out. An article by Tupel and Tanir in 2013 even stated that there are some potential chelating agents found in natural antioxidants, such as things like turmeric, garlic, and even ginger. And since chelating agents can be very expensive, this might be a potential new way to help with lower levels of lead toxicity. Now, there are some environmental regulations and monitoring for lead as well. The Lead and Copper Rule of 1991 and the Clean Water Act and Safe Drinking Water Act. These regulations and acts help prevent lead in your water source, and they make sure places that have older lead pipes are fixed, and work to make sure that no one is dumping these pollutants into a water source. But despite these regulations and monitoring, there are still a good number of children who have lead poisoning that's missed in the United States, as seen on this graph. Now let's take a look at pesticides. Jurowicz and Henke, an article from 2008, mention how in many homes and apartments, pesticides can be used to control termites, roaches, and rodents. And on gardens and lawns, we usually see them being used to kill unwanted plants like weeds. We've also heard a lot of agricultural use of pesticides to help crop grow better. Now, the problem comes when children are outside playing in these areas, playing on the grass, rolling around, or in the house after pesticides have just been sprayed. This is important to us because, like lead toxicity, it can cause developmental delay, decreased memory and attention, and other neurological conditions as well. As a pediatrician, it's super important for you to ask about where they are living, what a parent's occupation may be, if they're near agricultural land, and what their outside environment really looks like on a day-to-day basis. Thinking about treatment exposure, the best way is protective clothing and some avoidance of these pesticide areas. You want to make sure that when things are sprayed, that kids stay away from the areas as much as possible. In terms of regulations, the EPA does have a pesticide regulation and registration, where people and organizations have to register the ingredients of the pesticide, where it's being used, on what crop, how often they're using it, the amount, and even the timing of its use. They even have to talk about the storage and how it's being disposed. Now let's talk about inhalants. William et al., an article in 2007, states that inhalants are really most commonly used in school-age children and adolescent children. Inhalants include things like volatile solvents, nitrous oxide, which is also known as laughing gas, whipped cream aerosol cans, anesthetics, and even fuels. As a pediatrician, you really worry about these things because they can be common household items and even school supplies that are just constantly around children. And it's very important to educate parents and even teachers about childproofing the house for age-appropriate levels. Childproofing doesn't just end when they're born. The presenting symptoms of inhalants include things like having an initial high or rush, being a little lightheaded, disoriented, more likely prone to being very impulsive and making poorer decisions. They can also have severe effects like suffocation or aspiration, and a lot of different diffused organ damages. It can affect your brain, your liver, depending on what inhalant is being used. So in terms of treatment and prevention, the best thing to do is to increase awareness to signs, especially with parents and teachers who are around the kids the most. You want to make sure they're watching out for any signs of potential inhalant use, including things like decreasing grades that they don't really have a known cause for, kids starting to have poor hygiene, or even a shift in their behavior that doesn't seem normal. You want to also encourage the parents or teachers to work on reducing access to some of these inhalants, especially if they know the child has previous inhalant use. There are even certain bans and laws that state certain products can't be sold to minors in terms of inhalants, but you must make it clear during a pediatric visit to the parents that these are also items that are very commonly used in the household and even at school. You also want to make sure that when you're telling this to the parent, that you're not just giving the child new ideas for inhalant use. And last but not least, we're going to take a look at physical injuries. Segal et al., an article from 2004, states that a lot of unintentional injuries are the leading cause of death in childhood and adolescent in developed countries. And one of the biggest reasons for this is because our environment is designed for adults. Children aren't meant to go around functioning as adults, and our environment only further increases their risk for physical injuries. So let's look at some of the causes of injuries and how we can prevent them. The biggest thing for neonates or newborns is suffocation. The best way to prevent suffocation is to practice safe sleep habits. This includes babies being alone, being on their back when they sleep, and sleeping in a crib, not with a parent or on a parent's bed. When the child is a little bit bigger and is more mobile and running around, there's more risks of falls. In this case, we want to make sure the parent is monitoring the physical protection, such as wearing helmets when they ride their bikes or any other protective equipment. In terms of injuries from motor vehicle accidents, we really want to make sure that the child is in a proper car seat or booster seat or is sitting in the proper area in a vehicle. If they come in with a car seat, make sure you double check as pediatricians that it is a proper seat for the child. Car seats can differ based on the size of the child, the age, the weight, and it's very important to make sure that it is the appropriate one for the child. If you don't feel comfortable assessing this, then there are definitely safety specialists that you can refer them to. A lot more kids towards their toddler ages will experience choking, so it's important to make sure parents are aware of this, that they potentially know how to do the Heimlich maneuver and get help. We also nowadays have to worry about firearms a lot more. So we want to make sure the parents are practicing good firearm safety, that the firearms are locked up, put away, and away from their children. So if you've noticed, your biggest job as pediatricians is to counsel the patients and their parents. So especially in terms of physical injuries, prevention is key and counseling is definitely very important. So in summary, we've kind of looked at the different environmental exposures that children are exposed to. We've looked at lead, we've looked at inhalants, pesticides, and a lot of different physical injuries. We've looked at the method of exposure, how the symptoms may present, how we can potentially treat it or prevent it, and even looking at any regulations or monitoring for these environmental exposures. So ultimately, as future pediatricians, it's going to be your job to be fully aware of and thinking about all of the different ways these children can have these exposures. It's going to really affect your patients based on their age and their changes in behavior and environment as they grow up. So it's important for you to take into consideration all aspects of their life when looking at exposure risks. And because many of these exposures really affect a child's development, mental growth, and function, it's going to be vital for you to check up on these things during every well child visit or sick visit, and even more if you have a concern for an environmental hazard exposure. So here are some of the references that were utilized in this presentation that cover from things like lead exposure, pesticide exposure, inhalant abuse, parental awareness, and childhood injuries. If you have any further questions or would like to know more about environmental exposures, specifically in children, feel free to contact me, Pratheepa Ravikumar, at either my email or phone number. I thank you all for your attention and look forward to you all becoming future pediatricians and help reducing environmental exposure risks and hazards in children.